I'm Dr. Kayla, the dentist you can ask anything. Welcome back to another episode of Smile Makeover, where I will be talking about aesthetic dentistry and all things related. Veneers, veneers, veneers. It can transform your smile into a completely different one. But how on earth does it actually work? Veneers are a thin piece of tooth-colored material that are designed to cover the front surface of your teeth to improve its appearance. It's kind of like manicure, but teeth style.
Oh, I know. It is used to make our teeth whiter one, right? Yeah, but I saw some people, they do before, not nice one. It look like all the piano keys in our mouth, so big, so white, so squarish. Some more are so white, it looks like the toilet bowl white. That's why people want it, right? Because they want their teeth to be whiter, right?
Most people think if they want whiter teeth, they must go for veneers. But that's not quite right. If you are happy with the shape and size of your teeth and you merely want a wider shade of your teeth, you can try out in-office dental whitening. But if you want a shade that is very white and couldn't possibly be achieved with solely teeth whitening, then you might need veneers. The main purpose of veneers, however, is to improve the shape and size of your teeth. First, let's talk color. If your teeth are discolored due to specific reasons that cannot be improved with a simple in-office dental whitening, for example, fluorosis, infected stain, root canal treatment, or more, then veneers can help to improve the color and shape of your teeth. Second, shape and size. Veneers can help improve the shape and size of your teeth. If your teeth are practicing social distancing like this, and you're not keen on orthodontic or braces treatment, you may get veneers to improve it. If your teeth are too small, too squarish, chipped off, or uneven, the list goes on and on and on, you may get veneers to improve your overall smile.
Oh, sounds very professional. I pretend like I know what you're talking about. But there are only one type of veneers, or we can choose all the material one.
Now, what are the types of veneers? There are two main types of veneers: composite veneers or bonding, and ceramic veneers. Let's compare them in four categories: durability, process, maintenance, and cost. First, durability. How long can it last? Although composite resin technology has improved a lot, ceramic veneers are still stronger. A well-maintained ceramic veneers can last 10 to 15 years or even a lifetime. However, composite veneers or dental bonding can last from 5 to 7 years and more. Staining and chipping of the veneers may occur after this period. Ceramic veneers are less likely to chip compared to composite veneers due to its superior strength. Your dentist may repair or replace your veneers if such problems occur. Second, process. The biggest difference is tooth preparation, which means reshaping or shaving down of your teeth. Composite veneers most often doesn't require much shaping of your teeth unless in specific cases where it is indicated. However, this means limitation in achieving certain level of aesthetics. Ceramic veneers require a certain amount of thickness, commonly from 0.3 to 1 mm, to ensure the strength and aesthetic of the veneers. Hence, teeth reshaping is most often required in most cases. The amount of tooth reshaping depends on the type of ceramic used as well, and the thickness of the veneers required to achieve the best aesthetic. In short, it varies from case to case, person to person, so always consult your dentist. Third, maintenance. No doubt, composite veneers require more maintenance compared to ceramic veneers. Due to the porous nature of the material, composite veneers are prone to staining as well as chipping compared to ceramic veneers. Hence, routine polishing is needed for composite veneers. We usually recommend a review and polishing every 3 to 6 months, depending on the patient's dietary habit and social habits like smoking. Ceramic veneers requires less maintenance, but a routine scaling and polishing is still recommended every 6 months. Same goes to people without veneers. Lastly, cost. Ceramic veneers are more expensive compared to composite veneers. This is because the material itself is not cheap and a lot of preparatory work and contouring is involved in the ceramic veneer procedure. Composite veneers can be 2 to 3 folds cheaper than ceramic veneers. However, it might require more maintenance in the long run. If you're tired of maintaining your composite veneers, you can always change to ceramic veneers. That's all for today. I hope you now have a better idea on veneers, and if you do, don't forget to subscribe and like this video to show support. I'll see you next time. Bye!